Hey everyone, it's Dr. Alex from Atlas Orthodontics and the Holistic Orthodontist. Today I want to talk to you about impacted canines. An impacted canine is a canine which is the third tooth from the front. It's kind of the one that's the most pointy one, typically on the upper, when they grow in and they overlap the roots of the neighboring teeth. This is an example here of an impacted canine where you can see on the right side, this is the patient's right side, this canine has grown in and is overlapping the root of the neighboring lateral and incisor, and even over here you're starting to see that it's poking into the central incisor. Why is this a problem? Number one, it's a problem because that impacted canine, the head of that canine, the crown, the part that you would normally see erupting into the mouth, the part that you think of as the tooth that you see, has kind of an envelope of cells around it that is designed to essentially make the bone around it dissolve so it can erupt into the mouth. But if it's going sideways, if it's gone rogue, what it's also doing is it's starting to dissolve and to damage the roots of the adjacent teeth. So that's a problem. We don't want to damage the roots of the adjacent teeth. The other problem is that it's stuck. It's stuck there and it's not helping us. It's not functioning. So, and those canines are kind of a pillar of the dentition of the teeth. It has a really long root and it provides guidance to the lateral jaw movement. So it's really an important tooth to have as well. So those are kind of the two main issues of impacted canines, causing damage to neighboring teeth and also its absence in the jaw. As an orthodontist, if someone comes and they have crooked teeth and there's an impacted canine up there, we can't really move the roots of this lateral and central incisor because doing so would damage those roots even more. And so there's collisions that would happen that would make it difficult to also align the teeth. So one of the things that we have to do whenever we see an impacted tooth, number one, we have to decide, are we gonna keep that tooth? Are we gonna take it out, or are we gonna keep it and move it into its correct position? Or are we gonna decide to not do any treatment at all, leave the tooth there and just kind of be done with it? So typically we as orthodontists have to make that assessment. A lot of times, especially in younger patients, we are able to almost 100% bring in those canine teeth. I have a very good track record of being able to do so. So this patient came to me, she was 15 years old and she had an impacted tooth. Now that's one of the first problems that I was concerned with when I first met her, was that she was 15 and she hadn't been evaluated, or if she had been, it hadn't been diagnosed properly. And a lot of times these impacted canines can be treated easier later on, and we'll talk about that in a minute. But I want to just go through this case with you and show you how we corrected this problem. So in this case, the patient was 15 years old when she came, and we referred her to the oral surgeon, and what the oral surgeon did is make a small window in the roof of the patient's mouth right here, so that way we can access that tooth. On the orthodontic side, what I did is I did some expansion to also make room for the tooth. We have braces put on. That's what you're seeing here. Next, once the tooth is erupted and we bring it down, after the oral surgeon has exposed it, we go ahead and we start pulling the tooth into the arch. So we're stabilizing the other teeth and we're pulling with this elastic. There's different ways to do this. In this case, we did it with some elastic thread. We started pulling that tooth into the arch. Here you can see that the tooth is fully aligned, and now we're starting to almost just treat it like it was always there. Here the tooth is still aligned. Now we're still kind of waiting to let the root catch up, and here is the finished case. So we went from there to there. We're starting to pull it in. Now it's fully aligned. Then we start to treat it like a normal tooth, and there the case is finished. And here she is actually about a year after she finished treatment. We call this a retention photo, so we're looking at her in retention. Now let's look at the case also from the front. You can see from the front where she had the tooth missing. There she is from the front. Now we're making space. Then we have the tooth in, and there she is in retention. and her smile looks beautiful. Let's look at her smile. So here she is at the beginning with some spaces, and here she is finished. So here she is when she started, there she is when she's finished. Here she is in retention, and she has her tooth. So that was a 15-year-old patient, right? Well, you know, the sad thing is that she probably wouldn't have needed all that treatment at 15 if her parents had brought her in when she was younger, when she was 7, 8, 9 years old. A lot of times we can identify these things and we can treat them a little bit easier. So here's another case. This patient came in, she was 11 years old, and she had impacted canines on both sides. Now that we know what impacted canines are, you can see here that they're impacted. Again, this was not a patient that I had seen earlier. I don't know if she went to another orthodontist. I don't know if her dentist had been checking on this, but she ended up in my office when she was 11 for the first time. And at this point, these teeth are not at a point where we can take out baby teeth. They're so far impacted that we actually have to do the surgical exposure, just like I was showing you earlier. So she went to the oral surgeon, and the oral surgeon did an exposure surgery. This is a special type of exposure surgery that's called an open exposure, where we don't really try to pull on the teeth so much, but there's a special way to do the surgery where we can get the teeth to kind of erupt into the roof of the mouth spontaneously. Not every surgeon knows how to do this. This is something that really requires a lot of guidance from the orthodontist in helping the surgeons to learn and to understand kind of the principles behind this. No offense to the surgeons that are watching, but I've worked with a lot of surgeons that thought they could do this, but they didn't, and so it can be easy or it can be hard. And so the key here is to allow the teeth to erupt into the roof of the mouth first. That's the safe thing to do. Get the teeth to erupt into the roof of the mouth first, and then we swing them out to the side. So in this case, here they are, they're erupting. I'm actually helping to erupt them a little bit more. You can see that. Then we start to pull them into the arch sideways. In this case, you can see that instead of using elastic thread like I showed you earlier, we're doing this with these springs. And then here we go. Now we're connecting it to the wire. We're starting to pull the teeth in, and now the teeth are fully aligned. So let's see, how long did that take? So we started when she was 11. She had the surgery when she was 11 and 2 months. We started pulling. A month later, we started pulling the other way towards the outside. And here she is at 11 and 7 months, so we're 7 months into treatment. Within 9 months of treatment, those canines are fully aligned into the arch where they're supposed to be, and now we're kind of just treating it like a normal case. And she finishes by the time she's 14. We got it done. Let's look at it from the front. Here she is when she started. Here she is. She has some braces on. We're making space. We start to see that we're pulling the canines in, and there the canines are connected, and there she is finished. So the main takeaway here is have your child evaluated early by an orthodontist beginning at age 7. The orthodontist will look for many things, among which are impacted teeth, not just canines, but impacted teeth in general, specifically impacted canines. And if your child is older and they have impacted teeth, orthodontists can help bring those teeth in collaboration with a local oral surgeon that knows how to do this and has a good relationship and has a track record of working with the orthodontist to help bring the canines in. If you have a child that is 7 or older, I'd love to be able to help you out here with that at Atlas Orthodontics. If you have a child who's older who has impacted teeth, we have a really good batting average of getting those impacted teeth into the correct position. So I'd look forward to meeting you. Thank you.